Good afternoon and welcome to the Multicultural Media Online Conference. Thank you for joining us this afternoon. I'm Jesusa Helaratne, Deputy Director of the Multicultural Health Communication Service, and this session is hosted by the New South Wales Ministry of Health, Multicultural Health Communication Service with the support of Multicultural New South Wales. We're pleased to have back with us, Dr. Jan Fizzell, Senior Medical Advisor of New South Wales Health. Dr. Jan, thank you for joining us. Nice to see you again.
Great to be here. Thanks, Jess.
Thank you, Dr. Jan. And we also have with us, and we're pleased to have a very important person in the line. We see his cap here, Superintendent Adam Dewberry, Operational Media Liaison of the Fire and Rescue New South Wales. And he's here to talk to us about fire and safety during winter. Thank you so much, Adam, for being with us.
Thanks, Jess. Thanks for having us here today. It's great.
Thank you. We're going to talk about keeping safe, fire and safety during winter today. So please get your questions ready. But before we start, we'd like to begin by acknowledging the traditional owners of the land from which we are all meeting from today. We pay respects to elders, past, present, and future, and also pay respects to our Aboriginal colleagues and communities who are joining us in this session today. We also extend that respect to members of the multicultural communities and refugee communities who are represented in this session. And we are about to start this very important topic. During winter, you don't really talk about fire because it's cold, but it is essential. Adam, smoke inhalation is dangerous and can also be fatal. It's often the result of fire occurring within the home. What is your advice on how to avoid smoke inhalation? Because rarely we see it, but more often than not, we see it in the news now happening.
Yeah, it's a good question, Jess. And we will do more house fires in the winter period than any other period of the year. And you're right, smoke is the first killer. It's a silent killer. You will not smell smoke when you're asleep. So the best way to avoid that is not to have a fire in your home. And if you do, you need to have that early notification to get up, get out and stay out. And the best way to do that, not rely on the dog or your super senses, which you don't have, you need a working smoke alarm throughout your house. The law in New South Wales says one on every level of your home. That means if you've got two levels, one on each level. But that's the bare minimum. What we would like to see is smoke alarms through less than 10 years old, at least a 10-year battery or hardwired. That's electricity on the mains. So you can get that early notification so you can get up, get out, get your family out and stay safe and never go back in because the smoke kills you very, very quickly.
So it's having an escape plan that's simple and just easy to remember.
Yeah, absolutely. Just have the chat. It doesn't have to be a formal mud map or as in businesses where you have the maps on the wall. It's just talk with your family, talk with the kids, talk with your parents, the other housemates that you're living with. Just ask, if we have a fire now, even now, how do we get out? In a commercial building, you have green exit signs, which are emergency exits. You follow them. But in your home, your domain, your castle, how are you going to get out? Have you only got one way out? Do you need to have an alternate if you can't get out your door because of a fire in that front? Do you need to get to a window, shut the door? So important to have that home fire escape plan so you can get out quickly, have an area so everyone can be accounted for. Then the firefighters can just concentrate on saving your property and all your possessions and all those things and all those memories, the tangible and the non-tangible things. So important to have those escape plans. What are you going to do in the event of a fire?
What do you do? And you call 000.
Call 000, wait online. They'll ask police, ambulance, fire, ask for fire. Be calm, collected, take a breath. They will walk you through it. Just where are you living? What's on fire? Get your address out. What's on fire? If someone is inside the house, tell them because that notifies our firefighters. They'll always treat a home fire as someone inside. But if there is someone reported, we call that person's reported, that just puts it up to the next level. It's definitely game on. And they'll probably put an extra 2 or 3 trucks on as well to help that effort. And it will be a super effort. They will go above and beyond our firefighters to get in and look for those people that are unaccounted for.
Well, I just wanted to say thank you for all the work that you do and your team in keeping communities safe. It's really important. So thank you from all of us. And if there are any questions you have with Superintendent Adam right here, please put them on the chat and we'll get them answered. But Dr. Jan, in terms of inhalation of smoke and sometimes you escape, and what happens? What are the implications?
So one of the things is that carbon monoxide, which is part of smoke, it is very good at getting into our lungs and getting into our bloodstream, and actually it can actually stop the oxygen that we need for our cells and our body to function from working properly. And so if you're inhaling smoke, you can inhale carbon monoxide, and that can make you feel sick. There's also stuff in smoke. So whenever one of us has accidentally burnt a bit of plastic or whatever, you can smell on a very small scale that there's chemicals in there that really aren't meant to be going into our lungs. And so that's one of the things that can happen, of course. When you're breathing in smoke, you're not just breathing in, it's not clean. And so you can also breathe in things that irritate your lungs. And particularly if you've got asthma or other respiratory illnesses, that can really set them off. But one of the other things is smoke is hot. And so what it can actually do is it can cause our airways to have a thermal injury. And when we have that thermal injury, you won't necessarily feel bad at the moment it happens. But one of the things that we do look for is if you've got any soot or blackness around your nose or around your mouth. That's a sign to us, particularly if you're taken to hospital, which we'd recommend you were if that's happened to you. That we need to take particular precautions, because often you'll be okay just right after what's happened, but you won't be okay if your airways swell up. So that will make it very difficult to breathe, and you may need additional help with breathing. So it's really important that if you've been in a fire and somebody says you need to go to hospital and get checked out, that you take up that option. It really is very important.
Thank you, Dr. Jan. Now, fire and safety. This is Fire and Rescue. This is the month for Fire and Safe Month. Is that correct?
We started our winter fire safety campaign on the 1st of June, Sunday, and we're starting off with a program called Smoke Alarm Action Day. That's where we want people to get on board and check their smoke alarms, make sure that they're working and they're functioning, and test them. And our firefighters will be out and about, and that's what we want all the community to do, because it really is the first line of defence in their home for a fire, because there's any number of risks in the home that can start a fire. You can have the oldest home or the newest home, one person or 6 people living in it. There's always a risk in your home, especially with the modern conveniences we have.
But what, Dr. Jan, I guess for me, what are the health risks of the fire that, that could happen? And we'll talk about what those incidents what can happen, but just putting it out there, what are the health risks?
So one of the biggest killers is carbon monoxide, and we see that with people bringing outside heaters indoors, and it's silent. It's a quiet killer, and that's part of the problem. Is you're asleep and gone before you even know it's actually happening to you. Sometimes you'll get a headache or you'll start feeling sick. And going outside and taking a couple of breaths of fresh air is not going to fix that. So it's really important that people are aware of that. Of course, there are the burn injuries that can come with fire, and, they can range, significantly. One of the nastiest burns is where you've burnt not just through the outer part of your skin, but down deeper. And when that happens, you may not actually feel a lot of pain, but somebody who sees it or has seen burns before will tell you need to go and get that done. And that can be quite a long period of time with skin grafts and all sorts of things going on. The other thing is when we have other burns, and that can happen when we've pulled, hot water onto ourselves. We see it sometimes with older people who are in the shower and can't adjust the shower very well. They can wind up having a lot of hot water at them, and that's why we advise people to have their home hot water at particular temperatures to try and make sure that they're less likely to get scald injuries. But the key thing is that you can get burns are not just the skin. They can impact your skin, your muscles and your bones. They can lead to scarring. And depending, if you've got skin and that's got scarring over it, it can mean that your joints don't move as well. You can get infections in the skin, which is not very nice. And, worst case scenario, if you've had a lot of problems, you can have organ failure and people can, of course, die. So I think it's really important that we do everything we can to avoid those scenarios. But the key thing is also knowing what to do if it is just a minor thing that's happened around the home. And that is lots of people have got folk remedies for burns. I think, I've heard about butter. I've heard about putting ice on the burn, put the cold on the hot, all sorts of things. The key thing is if you're not needing to go to hospital right then, running it under cold water for 20 minutes. And that'll give you a good idea of how things are going. If you're getting a lot of blistering, or particularly if you're getting a burn that goes around an arm or whatever, get yourself checked out. We've got burn services in New South Wales, but your local emergency department anywhere in New South Wales is able to send photos of your burn to the burns teams in the particular areas and get expert advice as to what the next steps are, because having the right dressings, having the right advice can make a huge difference in the outcome for your burn. And so what seems like a little thing, you can get a much better outcome if you've got the right treatment. So don't be afraid to seek help if you've got a burn, particularly one that blisters or one where you're not feeling the pain, even though you looks like it should do. You need to go and get it checked out. And either the urgent care clinics or an emergency department, depending on how extensive it is, can help you with that.
And you're saying that run your burn over cold water. Look,
Yep.
I have a few burns because when you're cooking, when
yeah.
you're cooking in the kitchen,
Yeah.
that happens. And I always remember that 20 minutes and then you won't even feel it, and it'll help.
Well, it gives you time
Yeah.
for the skin to sort of calm down, and that gives you a good time to assess, have I done some damage here? If you've done some damage there, particularly if you've got blistering bigger than the size of a 20-cent piece, that's the sort of burn that you need to get reviewed. If you're a small child, of course, that 20-cent piece can actually cover quite a bit of a small child's surface area. So really important, particularly for kids, to get them checked out.
Thank you. And I talked about cooking. Now, where are the areas that are common for any fire to happen and for inhalation of fire can happen?
Yeah, we've got three main areas in the home. The kitchen, the cooking area, nearly half of every fire in the home, that's half of every fire in the home in New South Wales, starts in your kitchen. So a big risk. And it's as simple as paying attention. Keep looking when cooking. Don't leave it unattended. Don't come home after a big day at work or say a couple of beers or whatever else you may do and fall asleep. We also do a lot of that. A lot around the uni kids actually might do that. They've been out and about. They come home and want to cook the 2-minute noodles or a pizza and fall asleep. And next minute we're going there. Fortunately, a lot of those buildings are fitted with an alarm. So the cooking areas, and it is simple, just never leave your cooking unattended. I know it's a bit of the hour when you're at home, the dinner, the kids are in, they're running around, a lot of activity, homework, bathing, but pay attention. Don't leave your cooking unattended. It is just so easy. Probably everyone watching, myself included, talking here, have had a close call in the kitchen, and it doesn't take much. You cook up a little stir fry and you've got a little bit of oil in. Doesn't take much for that to turn into fire. Now, if you're not experiencing that fire, which most people won't be, and you come into seeing flames, a lot of people break into an anxiety attack and it just gets worse and worse. So that's why we just want you to keep looking when you're cooking. And if you do have a fire in your pot, it's as simple as really just turning it off and covering it, preferably with a fire blanket if you've got one, or the lid. But if it is too big, just get out and call 000. Just get everyone out. We can rebuild your kitchen, replace everything in, but we can't replace you. But I just want to reiterate, those burns and that smoke inhalation, we will get someone out of a home or at any building that's been on fire. They may even self-evacuate. If we see sooting, it is not uncommon for the high care paramedics to arrive and actually put them in a coma and intubate them, put the air tube down, because of the significant concern of the airway and the burns. And, the modern medicine that we get on the side of the road in Australia is just, I'm just continually amazed what our paramedics and the retrieval doctors do on the side of it. Get the camera down, they have a look. But so if you are exposed and they say, go and get checked, especially if you've got black and soot, get checked out. Take the advice from the experts, paramedics.
And what are the three things you should have? You mentioned the blanket. Now, please, this is important. This is so great to have you here to answer all the questions about what to do and be prepared for, and also Dr. Jan to answer how to keep our health and our family safe during any fire. But what are the three things that you should have, or are there things that you had? You mentioned a blanket, and is there a fire extinguisher? What should you have at home?
Look, I think best is a fire blanket. you have a fire blanket. If you have a fire on your kitchen, the oil that you can just simply put the fire blanket over the top. And what that does, it smothers it. It takes the oxygen that's in the air away from the fire and it will smother it. And most minor fires on your stove will be contained with that. But we also want you to call 000 and get firefighters, Fire and Rescue New South Wales, or wherever you are in Australia. Just get the firefighters to come down and check, because quite often there may be enough heat to ignite some oil or gunk up in your range hood, and that fire can then spread and just reignite and take off across your roof. So a fire extinguisher is good, but I don't see too many of them around really, but yeah, they're good. But a working smoke alarm, again, we'll always come back to that working smoke alarm. Make sure you have your working smoke alarm. 50% of the homes we go to, that's 50% of the homes we go to, do not have a working smoke alarm fitted, or it's just not working at all. And that does save your life. We know it does save lives. So make sure you've got them.
Now you talked about the kitchen, the cooking area. How about the sleeping area?
Yep. Sleeping area, where it's probably the next area where we have a number of fires. There's a lot less than in the kitchen. However, there's more injuries. So for example, in a winter period, we have 40% of those fires are in the kitchen, and we have 122 injuries, for example. About 8% start in the bedroom, but we're close to 114 injuries for a period of time. I haven't just got it off the top of my head at the moment. That's when you're most vulnerable. You're asleep, you're in a deep sleep, you won't smell the smoke, you won't hear the fire at that stage when it's just starting to smolder and kick off, and the carbon monoxide in that smoke, which is what kills you. You will sleep to death, will kill you. That working smoke alarm will give that early notification. And the other advice I like to give, if you sleep with your bedroom door closed, put another smoke alarm in your bedroom door. You may not sleep with your bedroom door closed, but you might have a housemate or kids, relatives. They sleep with their bedroom door closed, understandably. They want their privacy. Just get down to the hardware, get a 10-year. You can buy them for about $20. I bought some the other day for a demonstration at Open Day that we had. Good double-sided tape, clean it, stick it up. A lot safer than you were if you didn't have it.
Please ask your questions, put them on the chat. This is a great opportunity to just get the correct information. Now, Dr. Jan, who mentioned, Adam mentioned carbon monoxide. What's the remainder of keeping unsafe indoor heating as well?
Look, I think it's really important that people remember that there are problems with bringing in things like barbecues, charcoal barbecues, bringing inside barbecues full stop, even your gas barbecue, people bringing inside camping heaters, so the heaters that they take camping, they're not meant to be indoors, and people can die from carbon monoxide buildup with that. Even our normal gas heaters, Superintendent Adam will probably tell you about making sure that they're checked well from a fire safety point of view. But also we know that with those indoor gas heaters, they can also put out some particulates, and those particulates could make it more difficult for people who've got asthma and other things. So it's always important, even if you've got a good internal gas heater, to have some sort of ventilation in that room so that any dangerous fumes or whatever else don't build up. It's also really important to remember that if you've got a wood fire heater, they also put out a lot of particulate matter. So if you've got somebody visiting you who's sensitive with either allergies or asthma or other things, think about having an alternate form of heating, because we also know that it's also not great to be cold. And we know a lot of people are really sensitive to being cold, and we have had other years where, you know, elderly people have chosen not to heat, but also go to bed and put like 20 doonas on, but then when they have to get up to go to the toilet and they fall over, they can wind up getting really cold if they haven't got enough warmth on. So try and warm yourself up by layers to some extent, which I know is a uniquely Australian problem. If you talk to anyone who's come from the Northern Hemisphere, they cannot believe how poorly Australian homes are heated and the desperate things that we do to get warm in Australian homes. I think I saw a video the other day of someone from Canada, you know, sort of saying how I come in all rugged up and I take off all my layers and I'm nice and warm inside, whereas in Australia I come in and I'm not too bad and I put on my woody and I put on my extra layers and so on. But it's not a bad idea. So if you can warm yourself up by putting on additional layers, if you haven't got a warm house, which a lot of us don't have, it's really important that if we do decide to warm a room for everyone, that we do it safely, but also thinking about encouraging older people to have something just beside the bed to wrap themselves in if they are going to go to the loo and so on, because we have found, particularly with, costs going up, people being reluctant to heat their homes or doing things like bringing in the charcoal. So don't do that. Wear layers. It's not fun. I know I don't enjoy having to, look like a Michelin man polar bear as I wander around the house, but it's better than having unsafe heating in the home.
Thank you, Dr. Jen. I think that's really important advice. Now, we'd like to talk about things that could just fire up. Now, a colleague had mentioned that they had a battery and then they were charging it, and then they've had that charger for a long time, and it just a power bank, and it exploded in the sofa, and it just caught a bit of fire. Luckily, nothing happened, but apparently that happens a lot.
Yeah, it does. We're seeing a number of them. We're about 5 a week at the moment, different lithium-ion battery fires each week. Yesterday, we actually had 2 lithium battery fires out of e-bikes. One of them has gutted a unit down there in Glebe. Another one, a gentleman was actually just riding it along the street at Erskineville and it just burst into flames. We have definitely had a fatality out of Guildford. A poor gentleman in a share house had his e-bike on charge in the bedroom, failed, caught fire, and unfortunately he passed away in that fire. His housemates were able to get out, but it is a risk. They're a great convenience, there's no doubt about it, and a great energy source, but they do come with some risks.
So what are the tips? What do you do when you're charging it, or how do you know that it's not safe or it's faulty?
Yeah, the first and foremost, we say always buy from reputable retailers. Do your research. Be careful of the products you're buying. Be very careful buying online. And one of my examples is I have some power tools at home, as you know, most of us do, especially us fellas like to have those tools. And I went to buy, one of my batteries failed. It was 7 years old, it failed. First and foremost, can't believe I'm going to tell you this. I thought I'll go on YouTube, see if I can fix this. Because, they're $120 each. So I started to have a look and think, what am I doing? This is YouTube. This is where people are learning things or think they know boats, or as we know in that old commercial, but they think they can fix things. They start modifying bikes, which I'll come back to. I thought, I woke up to myself, thought, right, I can't do this. I'm going to buy another. I'll just go and buy. So you go online. A genuine one was about $130. I could buy 4, which look like genuine ones, for $60. So something just didn't sit right with me. If it's, what do they say? If it's too good to be true, it probably is not the good thing. So I went and bought it. So I guess it's coming back to buy a good product, buy from a reputable retailer, do your research. There's all sorts of information, any feedback, the Google reviews or whoever. Never leave them on charge continuously. Always make sure you've got the right charger for the battery that you're charging. We see this all the time with problems, particularly with the micromobility, the e-bikes, e-scooters. People will ask us about mobile phones. There's 1.5 million bazillion mobile phones out there, and we very rarely do a mobile phone problem. So I wouldn't be bogged down in your mobile phone. Okay. More worried about your power tools, your kids if they've got e-bikes, e-scooters. Chargers, definitely. Like my nephew at 11 at the time was telling me how to modify an e-bike. Where'd you learn? Oh, just off YouTube or TikTok. So if you've got kids at home and they're starting to play with their bike, don't let them. Just let them. Buying secondhand, be very careful. And then when it gets to its end of life, recycle appropriately. Go on site and look for where you dispose of it appropriately. But also remember, these batteries can fail if you drop them.
Okay.
Or they get damaged. Also, if your battery starts to bulge, just put it outside, get rid of it. And if it starts to bulge, smoke, or make a bit of a noise, just put it in a bucket of water.
So that's why it's so important that a smoke alarm is safely installed in your home. And I understand that you can actually your team goes and checks houses if you needed to.
You can reach out. It's on fire.newsouthwales.gov.au. You can see it on the website, our website. You can go in and book what we call a safety check, a home fire safety visit. The firefighters will come down, especially if you've got kids, bring them down. They bring the fire truck down. They can have a look at the truck and they can actually give you some advice on how to be safer. And one of the other things we see is power boards. We plug in a lot of electricity into power boards. They do fail, they catch fire, and they actually do wear out, even though you think they're not. They are drawing electricity and current and are wearing out, and they fail, causing fires as well. So anything that's drawing electricity can be a fire risk.
So that means buy at reputable places. Don't buy anything or pick up anything from the street.
Never pick up off the street. And if you're throwing stuff out on the street, cut the cord off so no other poor bugger picks up your rubbish thinking they're going to use it, because look, people can't afford things, they're going to try and use it. And we do see that, have seen that. So if you are throwing something out, cut the cord off right at the end so they can't just reattach it. So yeah, don't do that, but always buy good and be careful with that second hand.
Now, Dr. Jan, this is such important advice because it can get stressful for a lot of people, especially for older people when they're living alone and for younger people.
And I think that's the thing. It's about the smoke alarms give you an extra layer of safety there that, don't count on your dog or cat to wake you up. I mean, I'm not dissing Lassie by any stretch of the imagination. We all know that there are stories out there, but dogs and cats are also susceptible to carbon monoxide poisoning. So if the smoke's not waking you up, it's probably not waking up your dog or cat either. So don't rely on a pet to wake you up. And do make sure that you've got your smoke alarm, because I think one of the things that people often do is they get annoyed by them,
Yes.
don't they? And they take out the batteries and disable them because they've got cooks in their house like I've got, where sometimes the smoke, where there's smoke, there's someone cooking in my family sometimes. Actually, they're very good cooks. It's probably there's smoke when I'm cooking in my household.
Or in the kitchen at the hospital.
We might talk about call-outs to hospital kitchens and toast and why there's less bread in our hospitals. Yes. But I think that's one of the things that people do, isn't it? And it's so important that people don't do that.
Yeah, for sure. Dr. Jan, and you can put them too close to your shower, the steam sets them off. And we do see it. People pull them down, they're making a noise again, but put them in the right area to make sure that they're not going to give you that false alarm. And I just want to, as we're talking about it, the carbon monoxide is so important. And we get people out, quite often pets get lost, but there was a fire recently where a cat, the bedroom was not affected by the fire. It was actually relatively unscathed. The cats were underneath the bed. The carbon monoxide was what killed them. It wasn't even fire affected. So that's how toxic, poisonous and dangerous and how quickly it can move through the home with fatal consequences. And we're susceptible big time. Animals are as well. So, and the other thing with your bedroom and people, and Dr. Jan made a good point, we put layers upon layers on. We try and make things work. Little heaters working to heat up big areas don't. We put heaters too close to beds or lounges. Just keep that separation 1 metre or 3 feet, that far to keep that separation.
Well, that's really important advice. I mean, sometimes you don't think about it. You go to bed tired, you don't know what to do. So it really is making sure that winter, just because it's winter, doesn't mean that, we had beat the heat, because the fire can cause, but winter is as susceptible, we are more susceptible even in winter.
I think it's about making sure that when we move to winter that we check all of our equipment really thoroughly. You get the electric blankets out. Have you got wires there? Are the cords being pulled around? It's all of those things, isn't it? And being really aware of, I pulled the heater out. Oh, actually, it smells a bit funny when I turn it on. And it's all of those types of things that make a big difference to staying safe. And it can feel really expensive, can't it? Because things don't last as long as they used to. But it's much more expensive to have a fire and much more emotionally draining to have a fire than it is to replace a heater.
I can tell you, we know about the fatalities and the people that are left behind fatalities, but seeing people lose their homes, their belongings, it is as you could imagine. Well, to be honest, I can't imagine. You see it, but you see the devastation, the shock, the sadness, and they say, we're alive, that's good. But deep down, they will only know how deep. They've lost everything. Not only the things that they can touch, but the memories in that home where the kids used to sit, the grandkids sit, where they used to meet and talk, and the kids, that's all lost and devastated. And that can have a lasting, lifelong, devastating impact on their psychological well-being as well.
And that's why mental health, there are resources that we can contact and services.
And I think the other thing, though, to really emphasise is that when Fire and Rescue New South Wales come out to look at your home, you're not going to get in trouble,
No.
is the really important thing. And also there's no cost if you call Fire and Rescue New South Wales. So if you've had a small thing happen, calling them doesn't cost you money to do that. And I think it's really important that people know that Fire and Rescue New South Wales is there to help them and is a real service to our community, because it makes a huge difference.
That is so important that it is free, because a lot of people worry about that. Now, there are translated information that you have available on your website for communities.
Absolutely. For all the people from the different communities that make up our very diverse multicultural organisation. If it's not uploaded or yet, it's about to be, and we'll have all the translations on how you can be safe in your community, in your home, how you can keep safe. But it's a really good point that Dr. Jan made. Our service is free. We are not an authoritarian, or because a lot of people come in from overseas and they're old communities and we're part of the government. We're an authoritarian. We are not. We are there simply to keep people safe, prevent fires, minimise the damage, and also to protect them. And it is a free service. It's so important people understand that we are there to help. We are here to help. Firefighters in the fire station are your community, are your asset. We're here to service and help you out.
Oh, thank you so much, Superintendent Adam, for being here with us today. And we have run out of time. There is so much information, but any last words that you'd like to say?
Oh, look, for me, I just want everyone to know that life is precious. It can be taken away from any of us. Just be careful. Make sure you have your working smoke alarm. Your home and everywhere has all sorts of risks. Know how to get out. Keep your keys out. Working smoke alarms.
Thank you so much, Superintendent Adam Dewberry, Operational Media Liaison of Fire and Rescue New South Wales. Thanks for joining us. Dr. Jan Fizzell, thank you for joining us. Any last words for the community?
Look, I think the major thing is just making sure that you stay safe and spread this message to other members of the community who may not be part of this media conference or who may have heard about these types of things. So if you're a member of the community and you're hearing all of this, make sure that you tell the communities, tell your grandparents, tell your kids, tell the family, because the more people who know, some of the worst days of my life working in emergency were looking after people who had lost people in fires. And it was awful, awful. And if that doesn't have to happen to another family, doesn't have to happen to another fire and rescue person who's looked after that family, another paramedic who's brought that child to us, or another group of healthcare workers, and that is a very, very good day. So please, everyone, this is really serious and it is just awful when you're on the wrong end of it. So, and it's relatively simple to prevent. So please do that.
Thank you, Dr. Jan and Adam. Look, we have learned so much today. There's so much information available as well, translated information. The link is on the chat, but information will be shared with you online if you needed to. A recording of this will be available in the New South Wales Multicultural Health Communication Service website, and you can share this video on your socials and share it with your communities. Thank you again to our special guests. Thank you for joining us. Keep safe this winter. Fire and Safety Month starts in June. Keep yourself safe, and we'll see you again next time.